the White House has not seen them yet?
I'm not aware of the White House reviewing the guidelines, no.
And then on Texas, Governor Abbott said that the Biden administration must stop importing COVID into the country because he claims that COVID positive migrants are being bused into Texas and then sent to other places in the country. Do you have a response to that? And can you elaborate on what the government is doing to test migrants, if anything?
Sure. Well, we're about facts around here. That is not factual. So let me give you an overview of what happens. When migrants are placed in alternatives to detention, their COVID-19 testing, our policy is for COVID-19 testing to be done at the state and local level and with the help of NGOs and local governments. And that certainly is something that our policy is to have that be done, concluded before they are even moved to go stay with family members or others they may know while their cases are being adjudicated. And of course, our guidance to anyone, regardless of status, is testing positive for COVID-19 or experiencing COVID-like symptoms is, to social distance, to wear a mask, and seek medical attention as needed. But, in general, our approach and our policy is to work with local governments, work with NGOs to have testing to ensure these migrants are tested, and that can take place, and that steps for isolation, quarantining, and medical care can be taken should that be needed.
Why the burden is on state and local jurisdictions to do the testing and not the federal government?
Well, many of these NGOs have stepped in to help ensure that these steps can be taken. Many of these NGOs have also, if quarantining or isolation is needed, have even reserved hotel blocks in some cases, and you certainly have to talk to some of them about the steps they take. But obviously, their assistance allows the federal government to, work with local communities to get this done.
Thank you. Just one more question on migrants, specifically unaccompanied minors who continue to come to the border every day. We've reported that 96% of the HHS beds are already accounted for. Is the administration planning to open new influx facilities specifically for these children, and maybe at military bases or installations like we've seen in the past?
Well, I'm not in a position to confirm the specific numbers. I can say that there are, of course, a large number of unaccompanied minors who are coming across the border. And as you know, because we've talked about it in here, we believe that the humane approach is to treat these kids with humanity and ensure that they have a safe place to be. Well, I don't have anything to preview for you in terms of considerations underway at this point in time, but obviously we recognize that with the number that are coming in and the limited facilities we have and our desire to abide by COVID protocols, that it's a policy process that is imperative and a priority for this administration. Go ahead.
Senate Republicans have made pretty clear that they intend to